and I think that brings up someone who's coming into the frame, a professor in his own right, Bill Taranto, who has some big news for us. And again, for those of you who don't know, I'll give you the 20-second introduction. Bill runs the world's largest digital health fund, the Merck Global Health Innovation Fund, and was one of the early funders for Livongo, which sold for $18.5 billion last quarter to Teladoc, the telemedicine leader, and that was on 91 million in revenue. So not a bad multiple, actually, the second best multiple ever in Silicon Valley and just in tech in general. So Bill, first of all, thank you for chairing the HitLab Breakthrough Alliance for the next 3 years. Really happy to have you on board that, and again, in leading that organization within the lab, and excited to see where that goes going forward. But second of all, if you could give us some big news from your side of the world and what you've done.
Yeah, some real exciting news this morning. One of the other investments that we own in the monitoring space outside of our time with Livongo is a company called Preventis Solutions Incorporated, which is a cardiovascular monitoring company specializing in AFib. We were very fortunate enough today to, and it was announced by Boston Scientific, that Boston Scientific has acquired control and 100% of Preventis Solutions for a value of $1.25 billion. And it's very exciting for GHI because we actually built this company from scratch, from an original $2 million investment through multiple acquisitions and mergers, eventually bringing Boston in as a partner, and then building it again over the last 3 years to have this wonderful exit. And for us, it's our second unicorn in the last 18 months, because as you said, we were part of Livongo. Now we're part of the exit of Preventis, and but we're more proud of, we built a really good, sustainable healthcare company that's valuable to the healthcare industry, and that's always what's the most important thing about what we do. But very exciting news for our fund today. So thank you for asking me about it, Stan. Much appreciated.
No, it's just extraordinary, the success that you've had using the framework that you use with Joe and Prem and the team is just extraordinary. You know, HitLab has been around for 22 years, tracking the adoption of digital health from .coms and kind of AstroTeller and the original Body Media group there, and have seen what you all have done, which is extraordinary. And so, tell us a little bit about where you see 2021 taking us, and how things like the Breakthrough Alliance are important to that kind of ecosystem.
Yeah, well, most importantly, you know, one of the reasons I agreed to chair the Breakthrough Alliance, what I really like about it is, and it's for any type of company at any stage within healthcare, but you know, one of the things we even learned with Preventis, if we were a little smarter, would have done this much earlier, was really getting that digital health innovation validation through a rigorous scientific method that shows the value of your platform or your product. And in hindsight, we should have done that with Preventis, and probably would have helped us much sooner, much earlier. And to get those insights, I think, is what's really important. So I think one message I do want to give, is you think about whether you're a starting entrepreneur or even one a little more established within healthcare, the Breakthrough Alliance HitLab is such an unbelievable resource because it operates on a global basis. It gives you so many benefits if you're not only a member, but if you actually get into one of their cohorts, the type of work that they do to really help you understand, how good your product is there a clinical validation component to it, and what probably your success rate is going to be in the open market. And nobody does that. And I think that separates them from a differentiation perspective from any other group that's out there that offers maybe these types of services. And it's done, again, as I said, on a global basis. So I couldn't be more happier and proud to be part of the HitLab and actually getting to chair it over the next few years. So I'm looking forward to trying to get some of my companies now, into some of these future cohorts, because like I said, after watching it and learning, it's a valuable lesson to me as using it as a resource, because it does exist and it is available. To answer more broadly your question, one of the things we've obviously seen, and it'll be remain to see how big it gets applied, is certainly things like telehealth, because of the pandemic, where those type of technologies began to show value in reception and adoption. But what you're starting to see too is, and Preventis was the example, Livongo was the example. We also saw that Hillrom recently in acquired Barty DX. We saw that Philips acquired biotelemetry. You're starting to see that they begin to see the value of these types of technologies, especially around monitoring. So I still always have believed that monitoring is still part of the future of healthcare and still great opportunities because you can monitor everything, and anything. And one of the areas I think that needs to have this type of technology is in oncology. We don't see a lot of that type of technology yet. Obviously, we see it in diabetes and cardiology. That's the two biggest spaces, but there's a lot of other health areas. Mental health, I think, is another important area where we can use this type of monitoring. But I think if you're thinking of some of the different types of exciting areas, within healthcare, I think monitoring continues to be one of the best places to invest. And as you can see by the exits and the multiples, it certainly does pretty well. I also think, other sort of areas of oncology are also very interesting. And obviously I'm a little biased because working, as a fund under Merck, and we're heavily interested in oncology. It is one of our focus areas, but I do believe it's an underserved area. We're looking heavily at the use of tools like AI and informatics and analytics, especially as it relates to pathology, as a new modem of looking at healthcare. We're looking at, the use of the biome within healthcare. We're also looking at real new technologies like quantum computing. We think that's kind of a neat area in the future. One other big new area for us that we're excited about that I think has a lot of opportunity is also in the supply chain. We just recently did a investment in a drone company that's actually working with Pfizer to deliver a lot of the COVID-19 vaccines. We invested in a small cold storage box company that can keep that temperature for up to 14 days. So we think there's, and other areas including track and trace, fraud. There's a lot of great opportunities within the supply chain to apply digital health as well. Everybody always looks at it on the front end. And I think we're going to see the rise, it's early, but the rise of the DTX. I think the digital therapeutic is coming as well. As a fund, we're not knowledgeable enough on it just yet to maybe make some investments, but we're looking at it very closely. And we believe that's probably another interesting area that is ripe for future growth. I think you're on mute, Stan. Yep, there you are.
I am. So we have about 2 minutes left, and I think, when you look at the 2021 landscape around the pandemic, and we look at some of what both Damon and Shiv have talked about in terms of how do we what do we invest in next to change healthcare? What are some of the more transformational technologies that you're seeing or that you heard about at JP Morgan last week that you're really, aside from the investment thesis that you have, that you piqued your interest last week that maybe you hadn't heard about the week before?
Well, I still think the evolution of how you use data and things like quantum computing, I think, are going to play a big role within healthcare. Right now we see that used in things like supply chain, but it has a broader use case. The evolution of AI, virtual reality. I think there's a lot of interesting tools that are just starting. It sort of reminds me of where monitoring was 10 years ago, right? When we first brought in monitoring back in 2010, everybody was like, what does that even do? And so I think you're starting to see some of these interesting technologies, but it's really more to me around the evolution use of how do we get better access to data? How do you extract that data? And how do you turn that data into something more interesting? And I think those are the type of technologies that I think will have greater impact sooner rather than later. And especially things around the pandemic. How do you do better patient identification, better patient stratification? How do you get access? And then how do you use that data to better treat patients? And so I think and that's always been our theme, is data is the currency we're going to use to transact in this future healthcare market, and it doesn't change. But I'm starting to see technologies that are evolving the use of that data, and I think that's important.